Друзья, коллеги, всем привет! Я очень рада сегодня впервые открыть серию подкастов с нашими англоязычными коллегами. Я буду задавать вопросы нашему доктору, эндодонтисту Риязу Годилу, который работает в клинике по РБ. С нами в команде уже больше года. Я буду разговаривать с ним на английском языке. Вы увидите титры на русском. Если вы владеете английским, то вам и так все будет понятно. Так, поехали. Hello, Dr. Riyaz. I'm very happy to invite you here to ask you some important question for our clients, for even for our colleagues, because all we know that the huge culture gap is here in Dubai in all environments that we have where we can be every day in medicine, in dentistry, in sport, everywhere. Yeah, and but in my opinion, I know that you have faced with a lot of challenges, but you have already adjusted to this, kind of foreign environment. Please share your experience. How did you start to think that for you it could be, real good, maybe decision or good chance, and because you're quite high professional, and how did you decide to do this choice?
You mean the dentistry or endodontics?
I mean to choose the foreign environment. Yeah.
So actually, when I was planning to move to Dubai, I had nothing in mind, like which clinic would I work or which environment or which nationality. And I just came across the opportunity at Polar Bear, and I was recommended by a friend. I went through the clinic website, tried to know about it, and I found the standard of practice, the requirements that you had mentioned, all were matching my way of working. So I thought, why not? Let's give it a try. And for me, I had never some kind of reservations in my mind that I will work with this environment or not this environment. And I had a vast experience working with different cultures and different environments even before. So yeah, I could take it up like this.
So the secret is that you were so confident in yourself, correct?
Yes.
Am I right? And previously you already got this experience.
Yes, because I had been jumping from one culture to another culture since the beginning itself. Like even after I passed.
So how long it was?
It's immediately after I completed my studies.
Oh.
Yeah, I studied in a different state
was?
in 2000, and from 2010 to 13, I was studying my specialization. I was in one state in India, and then I moved back to my own home state, which is again a different culture, different language. So I was working with different languages and culture people since the beginning itself. And then I worked for 5 years in my home city, and I moved to Qatar, which is again an Arabic country. And I was working in army, where I was seeing a lot of other nationalities as well, including Turkish nationality. I was seeing Iranians, Americans, British, but to some extent, but majority of them was Arabic patients. Now it was for me a big jump from India to an Arab culture, but I could adjust with that setting, with that culture. So it was not difficult for me at that time. So when I was moving to Dubai, and when I came across the opportunity with the Russian clinic, I thought it would be.
But there is so huge gap between Arabic
culture. Yes, that I wasn't expecting, I wasn't anticipating that. But when I started working with you, I realized that there is a huge difference. The understanding is different, the culture is different, the awareness is different, the level of education is different, and accordingly the expectations are also different.
Yeah.
So yeah, but it as that's the quality of work is always the center of everything. So I was confident about my work, and I was sure that I would be able to satisfy the patients with my work. Now the remaining aspect of it, the management part, the patient management or the communication, was a challenge, which I learned, which I was able to adjust with some learnings from.
But it was really tough for you.
Initially, yes, it was.
Yes, it was really tough for first, I think, maybe 3
months. Yeah, I can say 2 to 3 months.
It was really tough to adjust to this such a huge difference.
Yes.
Yeah, and why you didn't refuse?
Because I was able to see good results since the beginning itself. Though there were challenges, but there were also some good positive feedbacks coming up. So that helped me to stick on to it rather than giving up.
But here in Dubai, we also know that there are a lot of other, opportunities not to go through this
Yes.
challenges. Just you can, because being a high performance doctor, you can choose any.
Yes.
You can got a lot of excellent proposal and offers from other clinic, from
Yes.
other even international, even Arabic clinic. You're specialist, yes, you have a specialist license. You treat very difficult cases and you save real cases which were refused by others.
Yes.
And you have a lot of choice. Why you put yourself in this challenge? Just explain me, I don't understand. What's the reason? What for?
See, the reason this thing is, if I move to another clinic or another place, just in trying to escape the
Yeah.
pressure, what's the guarantee that I will not face a different pressure there? It's always...
It could be easier.
It could be easier, yes, of course, it could be easier. But I was happy with the kind of infrastructure that was there at Polar Bear. I was having a good microscope, good equipments, good armamentarium, and I was used to using all these things. The only challenge at Polar Bear was the cultural difference or the language difference. This was the only thing, and which I was able to get through it. So I just keep trying, trial and error with other clinics or something. And with my experience for all these years, what I believe is giving time is more important at any place. If you are able to give time and learn the environment, learn in that environment, adjust in that environment slowly, and over a period of time, you will have great results. That's being persistent is more important than just keep moving from one place to another. Also, it doesn't suit you. You keep moving from one place to another, just experimenting. At this age, I believe experimenting is not an option.
How old are you, by the way?
I'm 39 years, but I have experimented a lot while in the initial years. I have worked with many clinics. While I was in India, at one point of time, I was working with like around 40 to 45 clinics as a consultant, as a visiting dentist, as an
Wow.
endodontist. So yeah, I have experience.
This is a really great experience.
Yes, and I have experimented all kinds of situations, be it substandard clinical practices to very high profile practices. And so when I moved to Polar Bear, I didn't find this as a huge challenge that I cannot overcome.
I see.
So I was able to overcome it, and now you see the results. We are here more than a year now, almost a year.
Yeah.
Yeah.
Yeah, this is very wise words that you have said about time.
Yeah.
That required to adjust, not to escape. So tell us about how do you manage this language barrier? Because as your chief physician, I have noticed that some patients, it wasn't from your side. Mostly it was from patients, yes? So how did you manage this?
Most of the patients are able to speak English to some extent.
Could you share with us in percentage how many patients do speak in English and might understand you?
70 to 80%, I guess, or maybe more than 80%. Up to 10 to 20% patients are not very comfortable with English, and they might require some Russian.
In Russian nowadays.
Yeah, and they might require some kind of translation or some help from other colleagues. So most of the time I'm able to speak with them in English, and they are also able to communicate back in English, and we are able to understand the treatment or the procedure, and it's manageable as far as this. But sometimes I need, or the patient needs, to communicate me something which they are not able to do it in English. They use Google Translation sometimes, or we call colleagues to explain us.
But we both know that some Russian patients refused to start treatment with you when they were suggested from reception side. But when they were recommended by some of our colleagues, for example, from prosthodontist or from surgeon, that they can trust you as a specialist, they go through it.
Yes, it's actually easier when I get a referred patient from my colleague. So the trust is already started building up from their office itself before coming to me.
So not from the reception.
From the reception, when I see the patient for the first time, it's a little difficult. I have to give time to the patient, and it takes a little while before they can understand me or have confidence in me. Yeah, but when they have a referred patient, the patient's mind is already set. They already have some background information about me. And in that case, it becomes easier.
What about patients that coming from others, from other side, from other clinic and doctors? Do you have such kind of patients?
Yes, I because I deal with complicated treatments like retreatments or
Yeah.
failed treatments. I do have cases of patients who are being transferred to me from another clinics. Yes, and they come with huge expectations, and when I am able to understand their problem, it's how the trust and the confidence starts to begins to build up. And yes, when we start the treatment, when the results are when we start getting the results, it becomes even more easier for the patients and for me also.
So, in order to to build this trust, you have to have a lot of instruments to display your results. How you do it?
It's first thing is the understanding the patient's problem and diagnosis, and it's the experience which helps you in all this, and then the right set of investigations, coming to the right diagnosis and the right execution of the treatment in a very properly mannered protocol with a properly set protocols.
You can handle, but how you can display it to patients?
Usually patients have some knowledge from the referral side itself. Okay, so this doctor will be able to help you with this complication or with this difficulty. And then some patients I see, they go through my cases on Instagram or the websites, the clinic website, and they already know that I am able to or I am capable of handling this kind of situation. And then when they come to me, they ask me sometimes that what kind of instruments or technologies I use.
So
Some patients I even ask,
they're educated.
yes, sometimes they even ask that do I use a microscope, because in my clinic there is a microscope already, but they ask me, do you use it? I said yes, I use it, and I have been using it for years now, since my education, since the time I was in the college I have been using it.
Yes, let's talk about cultural differences in Russian patients' approach dental care compared to patients from other countries.
Russian patients, what I see is they are more concerned about the preventive care. They want early intervention. They want to maintain the oral health all the time. It's not that they will come when there is a problem. They will try to visit the dentist and see if there is any potential problem happening there already, and they would ask for preventive care all the time, as compared to other nationalities where I've seen some patients from other nationalities, they visit the dentist only when there is a pain or when there's a problem, and at the time it's already too late. Sometimes the approach with Russian patients is like they don't want to be late, they want early intervention or preventive care, and they are educated, they are more aware about their oral condition. Sometimes they even say that this tooth numbering, they are also aware about the tooth numbering, tooth number 6, number 7, this is how they communicate sometimes. So it's a good amount of knowledge and education they have already.
So it simplified your work.
Sometimes it simplifies, but sometimes it also even becomes difficult when they have something in the mind that this is particular tooth, and when I say no, this is not the tooth, and this is the adjacent
You have
tooth.
to. You have
Yes,
to.
overall I will say yes, it is easy. It makes it easier, yes, as compared to other nationalities.
Maybe if we will talk about this culture gap again between nationalities, what kind of nationality is more difficult for you to explain some issues with it too?
I think when the level of awareness or education is less, it becomes difficult. The acceptance becomes difficult. But trust is the most important thing, as I would say, when I'm dealing with any nationality.
Yeah.
If they trust you,
Yeah.
then it becomes easier for me to communicate, and they will, even if they don't understand, sometimes they will accept the treatment. Regarding the explanation for the Russian patients, I have to give them a step-by-step plan. For other patients, I have to just give a general idea, like I will be doing a root canal treatment, and then this, and then this. For the Russian patients, they will ask me about the root canal treatment itself, like how many visits it will take, what kind of pain I can expect.
So they need more proper
They
information.
need little more information.
Could you tell us more about technologies and techniques that you are using to retrieve, to save these teeth?
I've been using microscope. That's the magnification. That's the most important part of my practice. Then using CBCTs to have a complete understanding of the anatomy and the morphology and the pathology.
But let's stop here, because some patients also doesn't understand why do they need to pay for CBCT. How do you manage this?
Yes, I see some patients are not ready to go for CBCT. Now, when we take a limited view or a two-dimensional X-rays, we get only a two-dimensional image, which is not enough sometimes. And we need to supplement it with a third dimensional understanding of the third dimension, or to understand the overall picture of the other teeth as well. And CBCT gives us that third dimension. It gives us the in-depth information, and it gives information from all the planes, because it's a three-dimensional image, and we understand the depth and detail of the tooth and the surrounding tissues in a better way as compared to a two-dimensional radiograph. Because endodontics, we are dealing with sometimes it becomes a blind procedure.
Yeah.
And this CBCT helps us visualize that thing. It helps us develop that image in our minds before we start the treatment. We know about the curvatures of the roots, and we know about any extra or additional canals which might be missed if you don't have CBCT.
Yeah, for you it's just obvious,
Yes.
yes, but for patients you can do.
Yes, I try my best to explain them what is the advantage or what is the benefit of going through a CBCT rather than going without a CBCT. And most of the times they understand, and then we can go ahead. Sometimes they don't. And sometimes there are situations when we have to stop the treatment because we don't have additional information. In that case, it becomes just compulsory to go for CBCT, or we cannot proceed ahead without that.
So what is finally the key of successful communication from your side?
I think the trust is the first thing. Second thing is the beliefs that patients might have in their minds regarding some treatments or some investigations. The language, of course, is the most important thing, because if you're not able to comprehend, or if you're not able to understand what the other part is saying, it really is like a broken communication. It's like a one-way communication sometimes. The trust, the beliefs, and the language are the three things I would say it's the most important for communication.
And let's talk about the cases when it was quite challenging for you, especially when you're treating a Russian patient. What maybe something the most blast for you?
For me, most of the times I see retreatment cases which have been done long back in Russia or the neighboring countries, where I can say, if you are aware that the tooth is red in color.
Yeah.
It's a
Red
peculiar
color.
peculiarity of the root canal treatments done in Russia a few years back, like 8 to 10 years back, or more than that. Or sometimes even I've seen some cases being treated recently with this red cement, and though this is called as Russian red cement also, and formaldehyde based formulations or resorcinol based formulations. And these are the very challenging cases that I face during the treatments. It's always unpredictable to treat those cases, to communicate those cases, communicate with the patients about the treatment progress and the results. Sometimes I have to anticipate that there might be a situation where we might not be able to proceed, or we might not be able to continue with the treatment, and we might have to stop it at that point of time. Because Russian red cement, I would like to say here, is a cement which
How do you call it Russian red cement?
because I have gone through the literature which mentions it as Russian red cement.
Wow.
It mentions as the Russian red cement. And
Russian red cement.
Yes.
I will just mention it in my notes.
yes.
Mhm.
And it is the most unpredictable thing, because what I read through was some dentists had their own formulations. There was no standard formula to formulate this, because when I see the cases, sometimes they are soft in consistency, sometimes they are very hard.
Yeah.
It's difficult to drill through them, and it makes the treatment.
It's like it's like a glass structure.
Yes, the
inside.
dentine becomes stone like
like
thing.
stone, like a glass.
Yes, glass. Very, very hard.
Yeah.
And whatever instruments I used, however new instruments I used, they just go in and come out
Yeah.
they're destructed.
Yes, they're destructive.
Yes, and you might
Totally.
even face with broken instruments sometimes. I might even break instruments sometimes.
Yeah.
But that's the only way to save the tooth. We have to give it a try to go through it, because what I've seen is the inflammation is developing.
Yeah.
And it is increasing in size
Under the
roots.
this
Yes,
hard
structure.
hard
And you see the canals,
structure.
they look empty on the x-ray. Even sometimes on the CBCT, it's difficult to see what's there inside. And there's no pain.
Yes.
That's the biggest problem, that
Yes.
there's no pain, and that's why it silently keeps growing in size, and it's destroying the bone. It's eating away the bone there.
Let's talk about preventive care. You mentioned that Russian clients are more educated in the area of preventive dentistry. Maybe you can share also some your ideas that you have, include in your practice.
They're already actually practicing a very good preventive approach. But some patients, yeah, they still ignore this preventive approach. And I would advise them to have a periodic visits with the dentist, have understanding about their oral conditions, and have professional hygiene done every 6 months. Sometimes, if they're very busy and if the hygiene is not so bad, maybe once in a year at least, but not more than a year, I would I suggest. And early intervention, if there is initial caries, you get it restored immediately. If there is some pain or sensitivity developing, visit your dentist immediately rather than waiting or ignoring it. It's sometimes irreversible condition which is just progressing silently, and you might not know until it becomes non-treatable sometimes.
We all know that mostly adults patients do not have any symptoms. Mostly when they come to you and you can see that there is no any symptoms, no pain, no sensitivity, but there could be some lesions. So how do they can understand it by themselves at home that there are some lesions and they have to come?
If they notice a change in color of the teeth, if they notice while brushing or while flossing their teeth, if they notice the floss is shredding away or it's just breaking away, or if they are noticing some bleeding from their gums, it's a time they should get a checkup done, because there might be a cavity developing there. There might be some gum conditions developing there, some periodontal issues. So this can help them, or this can be some indicators for them. Sometimes they might feel foul smell, and sometimes they might feel sensitivity to some cold stuff or sweet stuff. Yes, and especially if they develop sensitivity to hot, yes, it's in advanced stage already. Usually you don't feel sensitivity to hot in the initial stages, and it is always in advanced or in the chronic stages of inflammation of the pulp where you start feeling sensitivity to hot. Not always, but most of the times, yes.
Yeah, it's really important, but here we all know that it's easy when you deal with the Russian clients who are educated in oral health, in preventive oral health. But what I have faced also here with other nationalities, it's very tough to break this barrier to explain patients. What do you think? Do we have here any hope to educate most our clients from other nationalities, from other cultures, to invite them regularly to professional dental care, for example, as we do in our clinic each 3-4 months? For example, for airflow, for master prophylaxis procedure, which is quite safe and
advanced procedure.
Is there any chance, any hope that we can increase this level in all other cultures?
Overall, I would say the amount of understanding is increasing with time, especially in the younger generations. They are asking for preventive care or early interventions. But yes, with the case presentations in different languages, we can still try to make them more aware. Like we can, as we see on the Polar Bear Instagram handle, I see more of educational tips which we are sharing. If we can share them in different languages, and if we can reach out to those different nationalities, it can help them. It can break this barrier up to a certain extent.
How do you balance your professional life with your family, with your personal life? Because here in Dubai, we have this law rules to have at least some quantity of working hours, but also regarding you prefer to work more. How do you balance? You have 2 kids, as I used to know.
Yes, I get enough off time from my work, and that's the way I give my time to my family, my kids, my other personal work, and I have enough time to balance the situation. Is I'm not like overworked, or I'm not having time with my family. This is not the case. I have enough time to balance both the sides.
Yes, I'm very interested in And what are your future plans for your practice? Because you are really very high professional. And from my side, I see there are a lot of opportunities for you to develop. But what is your point? What is your interest? Where is it?
I would like to continue to upgrade my skills, my knowledge in endodontics and restorative dentistry. And as far as working with the Russian patients or international clients is, I would continue to do so until they are happy with me, they are satisfied with my thing. And it's at the end, it's the passion, that keeps you motivated and inspired to and keep growing. And the results, the satisfaction of those results is something that keeps giving you a positive feedback or a kick actually to keep growing. That's what is my plan. I want to develop more and more in my specialty.
Just mention something. What is, for example?
For example, I would like to expand my scope of practice, like even microsurgical procedures.
You mean apiectomy? Like
Apiectomies, yes, because that's something I think it's very much necessary nowadays when we have extensive restorative procedures happening. You cannot go for the conventional orthograde approach most of the times. We have to go for a retrograde approach, and that's very much required. As far as the restorative part is concerned, I want to expand my practice to indirect restorations.
If there is one thing what you want the Russian clients to take away from this interview, what it could be?
Don't ignore any pain or any discomfort in your already treated tooth or untreated teeth also. If you're having a endodontic, pulpitis or something like this, choose a dentist or dental clinic which has a microscope, which has a skilled endodontist or experienced endodontist who can take care of your situation. And to have background knowledge about your your dentist and having trust is the most important thing.
How do Russian clients can trust based on, for example, social media? How do you think it? What kind of advice you can share here?
I think if they go through my Instagram page, or if they go through the clinic website, which has enough information about my cases, about my profile, my experience, my education, I think there's a lot of information which they can go through and they can.
Do you think this is enough?
This is enough, actually. Yes,
for basic trust.
And I think they even ask the reception before booking an appointment, like what is my professional, what is my qualifications, what is my experience. So this can definitely help them make a choice.
So thank you very much, Dr. Rияz.
Thank you so much.
It was really great to talk with you. So thank you very much.
Thank you so much.
You have day off today. Yeah. But have to, come so early morning.
Oh, it's all right.